years, the Jacksonville dental specialists have provided simplified yet safe solutions for complex dental issues to those living in and around the First Coast.
And prosthodontist Dr. Nawrocki is responsible for restoring optimal aesthetics and function of the teeth. Welcome back. Good to see you.
Yeah.
All right, so today we're talking about this, it's a term, occlusion.
Yeah.
Occlusion. O-C-C-L-U-S-I-O-N.
Exactly.
Occlusion.
One of those weird Greek terms. So, as a prosthodontist, we're the recognized specialty of either replacing or restoring teeth, or really anything of the oral cavity, head and neck structures. And occlusion plays a fundamental role. In a nutshell, what it is, it's the way or the relationship your top and bottom jaws and teeth and supporting structures come together, and how that impacts things like force distribution, alignment, the health of your gums and bone, your joint and joint-based pain problems, aesthetics. All these things, materials, all these things are impacted to a high degree by occlusion, and it's what we as prosthodontists spend years of residency trying to grasp and understand these different concepts and theories, and then how someone's malocclusion or an altered sense of that affects all these things. And it can have dramatic effects. It can be as simple as premature breaking. Maybe someone got veneers done to improve the aesthetics, but it wasn't planned correctly, and now they're breaking or popping off. Or their jaws were put in a position that creates chronic facial pain, or it creates a lot of gum and bone disease and breakdown. So these things can have very dramatic effects, not just affecting how maybe a piece of porcelain breaks. It affects everything.
How do you make this successful, though?
It's as unique as we all are. You know, there's how many billions of people on the earth? We all have a unique occlusion. Now, there's different classes, but understanding how that particular person's jaws and joints and muscles and teeth and everything come together so that whatever that person's treatment needs are successful. So how are they functioning? How are they speaking? How are the forces being distributed? Do they have implants or natural teeth or a combination? All these things are different, and you cannot lump any one person into a one-size-fits-all. And unfortunately, that's oftentimes what's seen. Maybe half of the patients I see, they end up having these big reconstructions or trying to improve the aesthetics, or maybe a single tooth, and their general dentist maybe did the best they could, but not having a true fundamental understanding of this, and it leads to problems. And some of these problems can be quite drastic and severe.
So one of the things I learned, our teeth, you know, you think when you're little, you only need you know, braces because your teeth are moving, but our teeth continue to move throughout our life, always depending on different issues.
That's exactly right. Our mouth is a very dynamic part of our body. It's probably the most unforgiving, dynamic part of our body. And oftentimes what we do when we're replacing teeth with implants, for instance, or hybrid or full arch, we're really doing pretty drastic orthopedics. We're really replacing a missing body part on a unique joint system. It's the only joint of the body that has a hard stop. Every other joint, its ligaments, its muscles, it's the only one that has a hard, tooth-to-tooth stop. So it's very unique, and it behaves very differently. And with all these leaps and bounds in technology and materials and aesthetics and expediency of treatment, if you don't understand the fundamental concepts of how they're going to function and relate in that unique person, you're going to have a lot of problems, a lot of breakage. Even in the most planned out situation, you still can run into that.
Well, Dr. Nawrocki, we were talking before the show about some of your patients that came to you, and they came to you in extreme pain circumstances. And so there's danger in having this done the incorrect way.
There really is, and so that's, as prosthodontists, we spend years of training beyond that at dental school trying to understand this concept and how it applies to people. And when that concept does not apply correctly, it sometimes can be quite extreme. We've had patients that come to me and say it's created so much facial pain in their joints and head and neck regions that they've literally told me that they cannot go on living. If myself cannot help them, they don't know how they can do it. Or it's caused massive financial implications where people are selling their house because they've been put in this situation. So it can oftentimes be avoided, but you have to do your diligence and align yourself with the specialists that undergo that. And that starts with a prosthodontist. That starts with the architect or general contractor of the dental community, and then bringing in your other experts in the different fields. And so these can be quite drastic, or it can be as simple as a tooth breaking prematurely, or maybe wanting to optimize aesthetics. All of this plays a role in occlusion.
So much to learn. We learn a little bit each week on these segments, but the best way for people to come to check you out is to get one of those consultations or check out one of your seminars.
So you want to educate yourself. Every month we do a monthly seminar on your tooth replacement options relating to dental implants, and our next one is in about 2 weeks on Wednesday, May 16th. Please call and reserve your spot as seating is limited. It's been very well received by many people for the past 5 or 6 years.
Very cool. Best way to get all your questions answered right there. Thanks, Doc.
Right.
We want to thank Jacksonville Dental Specialists for being here and sharing this information. And you can call 904-460-4201 today to schedule a consultation, or you can visit their website to learn more. It's jacksonvilledentalspecialists.com.